Patients come to Bayside and all of the endoscopy centers to have either EGDs or colonoscopies, or sometimes both on the same day. This is where patients come in and they come up to the front window and they meet one of our wonderful secretaries. All three of our secretaries are bilingual, so it makes it very easy for patients to be able to discuss things. And then from here they get checked in, and then from here they're asked to come into the back area for admission by one of the nurses. And I'll take you in there.
Hi, I'm Carrie Alfieri, the clinical manager at Bayside Endoscopy Center. Once the patient comes in and they go through the registration process, we then come in and we do a thorough intake in this intake office. We do vital signs, and they also fill out their required paperwork before moving on to the admitting area. Okay, so this is the admitting area. This is where we have the patient come in. They put a gown on, they put their belongings under the bed. We have them lie on the bed, and then we put a nice warm blanket on them, and we start their intravenous access. And then when they're done that, we go into the procedure room. Okay, and this is the procedure room where the test will take place. We have the patient on the stretcher. We hook them up to all the monitors where we assess their vital signs throughout the test. The patient is lying on their left side. They're also hooked to oxygen, and we also do leads on their chest to monitor the rhythm of their heart. Then we go over their bracelet, we go over their name, their date of birth. We do like a timeout. The physician will then walk in. They also do a timeout. They ask the patient if there's any questions, and then he will begin medicating and then begin the test. So once the procedure has ended, the procedure room nurse takes the patient into recovery. They give a full report to the nurse. They go over the findings. They go over what medications that were given during the test, any important information that the nurse needs to know. They then hook them up to the monitors. We go over their vital signs every 15 minutes. They're here for about 45 minutes. Then we go over discharge instructions and make sure everything's okay, they're feeling okay, they're passing gas. And then the doctor also comes in and talks to them and discharges them. And then once they feel okay, then they're on their way to go home.
All right, I'm Jen. I'm one of the nurses that work in recovery, and I'm going to go over the discharge instructions with the patient here. So when you go home today, you'll be able to eat. We just ask that there's no driving today or no working. Any medications that you currently take, you'll be able to go return to. You may feel a little gassy or crampy following the exam, so the more moving around you do or sitting in the restroom will help with that. Following your procedure, you should have no pain. Chest pain, abdominal pain, develop a fever greater than 101. I want you to give the doctor a call. Just monitor your area where the IV was removed. In case you do experience some nausea after the procedure, that's a side effect of one of the medications the doctor gave you during your procedure. If the nausea persists till tomorrow, please give the doctor a call. No alcohol for 24 hours. And do you have any questions at all? All right, then I can walk you out to your car and you're discharged.